Hi everyone. Welcome back to my channel, Learn with Dr. Akshita. After a long hiatus, I'm back. This is one of my most requested videos. All of many of you have been commenting on my LinkedIn and Twitter asking for uh, how I am able to get various opportunities which I could get. So here am I. Here I am. I'm here to discuss the various opportunities which is available for an ID resident or a clinical microbiology resident. So, without any further ado, let's get started. First and foremost, the ECMID. So, let's see what all I have got. So, ECMID, I have got the outreach grant. I have got various postgraduate educational course attendance grants where I have pursued the courses on bacteriophage therapy. I've done my observership in Switzerland, Lausanne Hospital in transplant ID. I've also got opportunity to work with in a postgraduate course in systematic review and meta-analysis. Um, and recently, I have been conferred with the Outstanding Trainee Award by the TAE. And as a part of, because I was selected for the ECMID meta-analysis and systematic review group, I am now a part of the ECMID guideline as well as the cardiovascular implant infection diagnosis and management review writing group. So, what are the opportunities under ECMED? So, these are some of the opportunities which I have explored. So, just when you go to the website ECMED, uh, you will be able to explore the various opportunities. So, if you go under this profession and career, there are various educational activities. You can go and select the ECMED courses and workshop. So they have various courses, fully online courses. They have the on-site courses. On-site course, if you just click, so there is various on-site courses, and some of these courses have this attendance grant. So if you look at the sepsis and immunocompromised host challenges in 2024, there is an attendance grant. So, what is this program? So, if you just view the program flyer, you will just see the program list. And if you're interested in this course, if you look at this, so through the attendance grant, your registration fees, which includes course material, 2 days of lunch, coffee, and tea breaks, will be free of charge. And be aware that some of the courses will also cover your accommodation as well. So there are various on-site courses which you can apply with the attendance grant. Then there are various online courses as well if you can't attend the offline courses. And there are very good courses like antimicrobial use in intensive care and emergency in department, PKPD, AIM is in difficult to treat infection in high resistance endemic settings, etc. So there are various courses which you can attend online as well. So apart from that, you have uh, this observership. So observership is nothing but you get an opportunity to work, or work means you to observe for up to 1 month in various countries. So as an Indian, you are eligible to attend any of the uh, centers in the Europe. So there are various kinds of observership. There's funded, non-funded, special funded observership. So funded observership in the sense they will be sponsoring you. That is your travel and accommodation costs up to a specified amount. And non-funded is one where you can go to the various countries with, but this will not be funded by the ECMED. Special funded observership include your two kinds of observership under, that is myoclinic observership, which unfortunately is for not for the Indians. Then we have the ECDC observership. This ECDC observership uh, is nothing but the European Center for Disease Prevention and Control, and it is held in Sweden. And it's a 5 days program where 20 observers are offered this program. And there is eligibility criteria. You need to look at the eligibility criteria and then apply. And if you're selected, you'll get a mail and whatever the cost will be reimbursed. So the cost which will be reimbursed is for intercontinental observer, that is Indians, you 1,300 for travel expenses. Next, as I was telling about the ECMID funded observership, this is through which I got the Lausanne University or the CHU Hospital Switzerland observership. So there are various centers. So again, there is a eligibility criteria, that is you must be young scientist member or LMIC member, and you can choose any country in the Europe which is given in this list. And the reimbursement details, if you see, for an intercontinental observer up to 2,000 euros, which 1,300 is for the travel, and 70 euros per day for maximum of 10 days. So there are various centers. So if you just see at the ECC profiles, that is the ECMID collaborative centers profile. And if you just log into this, you can select which country you want to go for the observership for. In Switzerland, I had chosen Switzerland. You can type in any keywords if you're interested in, like if you are interested in HIV, antimicrobial stewardship, transplant ID, you'll be given choices accordingly. And this will be open. So this observership call happens 2 times a year, and you 50 observership 50 people will be selected in each call. So the spring call will open from 16th April to 15th May 2024, whereas the summer autumn call will open from September to October. Um, so you can apply for this, and before you apply, you should look at the eligibility criteria as well as get a endorsement letter from the ECC center. Then apart from the observership, what else we have here is there is various research and project, various grants are available under that as well. Then uh, then there is mentorships again, which is available if you can't get to the observership. There is this mentorship which is available. Again, this mentorship center is certain centers, that is mentorship centers, ECMID membership centers. You can look into the details of each mentorship center, and you can apply for the mentorship. Basically, again, it will be like it can be online as well, or you can even visit the country or the center, and you will be reimbursed accordingly. Then apart from that, what you have here is the various awards and grants. Awards and grants. So there are various ECMID awards, and in that there is ECMID Excellence Award for Scientific Contribution, Lifetime Achievements Award, Outstanding Contribution in Field of Infection, Young Investigator Award. This is for the basically Young Investigator Award, Emerging Young Investigator Award, and TAE Outstanding Trainee Award. So this is what I have got this year, and all these awards have been started since 2010. And best part about this is it's not the only Europeans who are eligible, even other country people are eligible. And TAE, like there have been only, though the Indians are very few in number, so there have been only 2 Indians from 2010 who have been selected. So TAE Outstanding Trainee Award is for multi-skilled medical trainees engaged in extracurricular activities, teaching, networking, collaboration in clinical microbiology and infectious diseases, and it is open annually, and they are awarded during the ECMID, that is ESCMID conference. So one will be selected in clinical microbiology and one in ID. Then we have the Emerging Young Investigator Award. So this is for the emerging new scientists who are clinicians, that is who are just up to 5 years after completion of your training in the LMIC in the field of clinical microbiology or infectious diseases. There are also all these awardees are felicitated in the ECMID conference, and not only the award, you will also get there is lot of prize money as well. So TA Outstanding Trainee Award, there is a prize money of 1,000 euros. Along with that, they will be covered travel and registration for the ECMED, as well as there is ECMED summer school, which I'll be discussing later. So when that will be reimbursed. Then whereas in emerging young investigator award, prize money of 5,000 euros, which can be used for the professional development. um, and after that, you will have to submit the details of what you have used that for. And then we also have young investigator award. So again, has a prize money of 5,000 euros, which can be used for any form of professional development. So these are the various awards, and obviously these other awards are more for more professionally advanced people. So a resident can apply up to your young investigator award. Then one more thing which I forgot to discuss was the um, education. If you go under the educational activity, we have the ECMED summer school. So again, this is a wonderful opportunity. So this is a 1 week program we're dedicated for postgraduates, and it covers a broad range of topics from clinical microbiology and infectious diseases. So it's a great program if you are interested in, and you have to apply for the program, and only up to 20 people will be selected in this. And they will uh, so this registration fees will be around 1,100 euros. And there is also attendance grant which is there. And this attendance grant will cover the registration fee as well as the accommodation, including your breakfast, lunches, and coffee breaks. Though the travel is not included, this is a great deal for 1 week. And accommodation and food will be included in this. If anyone is interested, can go through this one as well. Then you'll have to make note of the last date for the attendance grant. uh, so these are the various opportunities I have explored in ECMED currently. Then apart from that, I would advise everyone to take this membership for ECMED. For the LMIC, it is just 7 euros per year. So it's a great deal for the things they are going to offer. So all these are available only for the ECMED members. And apart from that, there are various subgroups which I hope many of you will become subgroups that are the study groups. So this ECMED study groups basically are the there is like anaerobic infection, antimicrobial stewardship, biofilms, brain infections, clostridioides difficile infection, critically ill patients. So these are all the various study groups. So again, the various study groups also conduct their own webinars, and there are various grants also which is available under this. Then apart from this, if I look at the ECMED event per se, so there is ECMED event. So the ECMED is a yearly conference. Uh, it usually occurs in the month of April to May, and this year's ECMED is in Barcelona, Spain. And there are again various funding opportunities even in this. So for the ECMED conference, again there is various grants which are available for you to attend the ECMED conference. Uh, just a second. So Just so let's just go to ECMID. So ECMID has various again so grants which is available for you to attend this ECMID. It's a great event. So in this there is something called outreach grant, there is travel grants as well as the Fordavarian grant. So ECMID travel grant, there is up to 100 travel grants up to 500 euros. Usually they are selected for the, top abstracts will receive this award. Then there is ISF ECMID Sepsis Award. Then there is ECMID Outreach Grant, which is a great deal because this is basically for LMIC and low and lower LMICs. So they will be given free registration as well as stipend, which will support their flight tickets and accommodation to attend the Congress. Then there is something called Fordavarian Grant. Again, this is applicable for LMICs like India, where this grant again will cover free registration to the Congress as well as the flights and the accommodation. And there are various study group grant like ECMID study group for epidemiological markers, again who will have a grant of 750 euros each. And there is ECMID study group for food and waterborne infections, again they will have to travel grants of 500 euros each. Like that, various study groups will also announce their own grants, like even antimicrobial stewardship study group recently announced a grant of 1000 euros, which is a great deal. Then apart from this, there is again various research grants which are available. So if you are interested in research, there is various research grants again which is available. So this research grant is available for individual. It is available as a study group per se. So this ECMID research grants, there is individual research grant, study group research grant, study group collaboration grant, etc. So individual research grant is applicable for individuals, and you'll have to. There is alternate years. So one of first, if this year there is bacterial infections and diseases, including diagnosis, etc. The next year it will be on the various antifungal, antiviral. So alternate year they will have on bacterial as well as and fungals and antiviral, etc. So again, there is basically you'll have to submit your proposal, and a grant of up to 20,000 euros per project is permitted. So that's about the ECMED. So next, um, let's move to the IDSA. Through the IDSA, I've got two grants. One is the I to attend ID Week. I've got ID Week Trainee Award, and I got a chance to present in the Bug Hub stage. And again, from the IDSA, I've got one more grant, that is the AMR grant. So if you just look at IDSA, though they are not as liberal as the of ECMED. So though they are not as liberal as ECMED, but they again, this is one of the great society to be a member of. So once you are have a membership for up to 5 years, that is a full membership, you can become a fellow, or you can apply to become a fellow of IDSA, that is FIDSA. I'm sure many of you would have been familiar with this FIDSA. So there is two criteria for FIDSA. One is the clinical practice track, another one is the academic or investigator or administrative track. So once you have the you have been full member for the IDSA for 5 years, after completion of your training, you will be eligible to apply for this. Along with that, you will require uh, that you must be identified with the field of infectious disease, and you should have some national or local recognition for clinical practice track for and publication of your work. For the academic, you will have again similar thing, along with publication, national recognition, as well as the continuing identification in the field of infectious diseases. Then apart from that, there is various volunteering opportunity which is available in the IDSA. So you can be the reviewer for the IDSA journals like CID, OFID, etc. Then ID Week is one of the great opportunity. In ID Week, again there is various grants which is available to attend the ID Week. So usually it is in the month of October, November, and so in the ID Week again you have the various travel awards. Uh, so there is committee choice award where you get around 2500 USD to support travel. Then you have top abstracts submitted in diagnostic. The top abstracts will get an award of 2000 USD. Investigator awards will get intended to recognize the work of investigator in practice for less than 15 years and whose abstract has been accepted for presentation at the ID Week, and this is based on the merit. So award of 1250 USD. Then there is International Investigator Award. For it is around 1500 USD. Then we have the various trainee awards. So this is a trainee award for supporting fellows in training to attend the ID Week, and it is uh, of 1250 USD, and this is usually integrated with the submission of the abstract. Then Durant International Travel Grant of 1600 USD for the international participants living in the resource limited countries, that is your LMIC countries. There's a limited amount which is available, and again this is integrated to the admin abstract submission process. Then we have the CAS awards. So up to 10 awards are there, but it is usual for medical students, residents, and house officers, that is your interns. And of USD 750 USD is the prize money to cover your travel expenses. So this is a great opportunity. ID Week is one of the biggest conferences for the ID of the ID community. And in ID Week, there is various opportunity. There is something called escape room. Then there is CV reviewers. Then you can even explore various opportunities after ID, etc. And it's a great networking opportunity, I would say. Then apart from this, next is the RSTMH, that is Royal Society of Tropical Medicine and Hygiene. So recently I have been conferred to be the student ambassador for the RSTMH. So what is this RSTMH? Many of you may not be familiar with it. So let's look at RSTMH now. So what are the opportunities under RSTMH? So again, just like any other society, there is various grants which is available. There is various awards which is available. So RSTMH is nothing but Royal Society of Tropical Medicine and Hygiene. So under this, you have the various grants, that is for the study. and usually the proposals for the grants open from Jan to usually April, and it is for the 5,000 pounds, and usually it will be granted in the name of the institute. So you can use this grant for conducting any study for up to 1 year, and the usual topic related to tropical medicine, global health, including lab based study, including clinical studies, and they have increasing the grants year on year. So this year you have around 230 grants which is available. So again, it requires that you need to be a member of RSTMH, and it is quite reasonable. Then again, there is various medals and awards which is available, like Emerging Leaders Award, then Donald Mackay Medal for Mid Career and Senior Award, then Chalmers Medal for Mid Career, and Sir Patrick Manson Medal for Senior, Hemming Award for all career stages. So these are the various awards which is available, which is a great opportunity and great, and each of it will have some prize money also attached with it. So, and the student essay prize, it is just for writing an essay. You have there is no limit for the like qualifying limit for that. Then you have the Emerging Leaders Award, then Sir Patrick Manson Medal, and George MacDonald Medal. You can look at the various criteria for all these awards and apply accordingly. Then they also have various journals under them, so you get good membership to these journals as well by being a part of this RSTMH. So that is the transactions and international health. These are the two journals which have, and you can also get opportunity to be a peer reviewer in these journals if you are a member of this RSTMH. Next, ESPID, that is European Society for Pediatric Infectious Diseases. So recently, I have got selected to be a part of the Young ESPID debate. So this year, I'll be talking on debate on corticosteroids for the treatment of HSV encephalitis in Copenhagen. And the best part about this is they will cover the entire cost, the travel, the accommodation, everything is taken care by them. ESPID is just like, I mean, like ECMID, they have lot of opportunities. I have not explored much of it till now, but I would hope all of you could explore. So if you just go to espid.org, they conduct various webinars, they have case rounds, they have journal club, then there is various training modules which is available under the ESPID, then there are various awards, various grants which are available. So we'll have a look at it now. So just ESPID, if you go, then there is this awards. So there is available awards if you just go. It's a little slow. I mean, my net is a little slow this evening. So if you see the education and training, there is Walter Margaret workshop, which is a part of the ESPID annual conferences. Sorry, okay, it opened. So the awards, these are the various awards. So it comes with a deadline. There is Bill Marshall Award, Distinguished Award for Communication, Education, Honorary Membership, Small Grant Award, Fellowship Award, General Travel Award, Young Investigator Award, Training Course and Workshop Award, then Systematic Review Grant, Research Presentation Awards, etc. All the awards which are available under ESPID is a great thing. So you can look at the various details which is available. Basically, you have to be a ESPID member, as well as some of these awards are applicable only for the young ESPID, that is less than 35 years or within 5 years of the completion of the training. Then also these you'll have to be a good standing member in this case. So the good standing, there are various points given. So the points are based on whether you have done a case rounds, or whether you have participated in journal club, then when being a member, presenting paper as a first author in the ESPID conference, etc. So then under young ESPID training, you have um, awards training, you have PID training program. Then in education and training, you have the case rounds, ESPID online courses. Then there's journal club and quiz club. So ESPID case rounds is nothing but if you're a member of this ESPID, there is case rounds which you can. It is nothing but you'll be submitting your case, and you have to write few questions and with the answer, and it's not a video recording. It's a just your case based study. So where it's like a course on the case. So each you will be presenting certain points and leading to the final diagnosis. At each point you'll be explaining why you're doing that step. Then there is the journal club and quiz club. So basically any new journals you can apply to be you can volunteer to be a part of this journal club by you can there is a monthly call which is there, so you can choose and be. So I had presented in the case rounds as well as the journal club this year. um, and in the resources you have the various ESPID guidelines. So all of these societies like ECMID has its own guidelines, IDSA has its own guidelines, and you are so if you are ECMID member, you will get membership to the CMI, whereas if you are IDSA member, you will get membership to your OFID, your CID journals, etc. And if you are a member of this, you will get ESPID guidelines, etc. So these are some of the opportunities which I have explored. Then again, there are various other societies like TID, that is Transplant Infectious Diseases. Then there is AST, that is American Society of Transplantation. Then there is ASTMH, that is American Society of Tropical Medicine and Hygiene. So all of them, they have their own conference. So based on your interest, you can go and look up for these conferences if you are interested. And the conferences are just not an opportunity to present your work. It's a great networking opportunity, and for those who love traveling, it's one of the easiest way you can travel. And there are various I would like all of you to explore their website so that you can know about the various awards. So each one of them will have various uh, awards, and unless you try for the awards or the grants, who knows whether you will get it or not. So I hope all of you will apply and be successful in the future endeavors, and never say never. So keep trying until you succeed. That's all about today's. So I try to cover in brief about the various opportunities I have explored, and I am sure you guys may find many more. So these are the some of the ones which I have done. So yeah, that's it. Thank you. Bye. And if you like my video, don't forget to like, share, and subscribe to my channel.